Vascular surgery is a very unique specialty. It requires a lot of technical precision in the surgeries. The surgeries are very elegant, they're beautiful. Sewing a vascular anastomosis really requires a lot of attention to detail, precision. Really, the operations have to be perfect. And these complex and oftentimes advanced operations are done in frail patients who have lots of vascular disease, they have heart disease, diabetes, and many risk factors that really makes these patients fragile. I think the biggest part of my job is really to listen to the patients. While I understand the technical aspects of their aneurysms or their vascular disease or their carotid disease, I really want to listen to them in terms of what they hope to get out of this, what they enjoy most in life, and what they would really like to get back to doing. Having that understanding and then slowly sort of offering them what the options are and having all of these tools at your disposal, minimally invasive, open, working with other specialties, and then bringing that all back together in a way that's really individual for the patient and what they want is really the key. My name is Virendra Patel. I'm a vascular surgeon and the Chief of Vascular Surgery at Columbia University Medical Center and the co-director of the Aortic Center with Columbia Doctors and New York-Presbyterian.